Good afternoon. And I think it's tea time for most of the people, but I think also it's a great time to talk about healthcare, especially after some fascinating talk on cyber security and some talk on education, some talk on philanthropy. I think healthcare is going to really play a huge role. I want to start a bit about giving you an introduction of what Siemens Healthineers is all about. In India, we pioneer breakthroughs for everyone, everywhere, sustainably. I mean, this is a company's purpose, and we are trying to do a lot of things. We put everyone everywhere because I think what we want to really make sure we are addressing is 50% of the world is still not having access to healthcare, and we want to reach there. We want to make sure the technologies that are being developed are reaching patients, investors, employees, technologists, clinicians, radiologists, and everyone. I think that's why we wanted to call it as pioneering breakthroughs in healthcare for everyone, everywhere, sustainably. And India, we are also, I think, one of the things that many people may not know. Siemens Healthineers has 18 hospitals which are run by Siemens Healthineers. These are cancer specialty hospitals which are run across the country from Jammu till Sri Lanka. We have one hospital in Sri Lanka. And these are there are a couple of super specialty hospitals. These are owned by Siemens. Along with the technology, we also have a touch with the customers. And we have very good specialty on cancer treatment. And these 18 hospitals, all these 18 hospitals have cancer specialty treatment. I think this is a chart that actually is startling to know the non-communicable diseases that are there today. They actually contribute to so much of death. And the first one, in fact, last 3 or 4 months, my friend Hubert also knows this, in our layout, we had 2 people who passed away without even giving any chance to anyone around them to give a opportunity to save them. Just about a week back, we lost a very young man who just passed away while he was working in the night. No one could know it. People could know only after a couple of hours of his death. And these are the things that actually make Siemens Healthineers think about it. What is it that we can do? How technology can change it? It is not that these things happen suddenly. We only notice it after the event. But there are a lot of indications that happen that are not known to many people. And many times, I think people who are not near the availability of the support system or the clinical support system, they end up not really being able to get the help. And this actually brings in a question: where we live should not decide if we live. I mean, this is a very powerful statement. I think this is something that I always think about it. Where we live should not decide if we live. And that's where Siemens Healthineers actually started thinking about how do we bring technology to remote parts of the world. And that can change the entire healthcare industry, healthcare ecosystem. Globally, over 3 billion people still do not have access. There are many, many remote parts of country, India itself, where still, the diagnostic or imaging or good care facility has not reached. And we are trying to really put a framework across the company to really build. It's not going to be possible just through technology, but also through partnerships. PPP. How do you create? Sustainability we are talking about as a way of not just creating products in a sustainable way, eco-design products and all that kind of thing, zero carbon footprint. But we are also talking about healthcare in terms of sustainability of human lives. And how do you do that? And you can do it only through a lot of partnerships. And we are looking at partnership building in the country through a lot of PPP. Making screening mechanisms that can really help, working with government. These are different ways to create impact in the region, impact in the access to care markets. Those are becoming our big challenges. And the other challenge, if you look at it, the waste that happens today in the healthcare industry, this is something of, probably many people do not know. Earlier, we talked about cybersecurity creating a challenge of, trillions of dollars of challenges, of losses. In healthcare itself, if you look at it, in US alone, there is an estimate that nearly $2 trillion of wastage is done just because of wrong diagnosis or a wrong treatment or, totally impact created due to that. And these could be of different kind of challenges, clinical inefficiencies, wrong diagnostics, overuse of medicine, and many more. And all this causes a huge amount of loss to the entire world. And we are trying to look at how do we really build a way to improve that. Look at the challenges from population. It's going to grow from present 8.6 to nearly 9.9 billion in a few years' time. But the even bigger challenge is the skill level that is required to really manage the healthcare for all this population. The gap is going to be over 18 million personnel that are going to be missing over time. But the good news is the computational capability is increasing exponentially. Earlier, we had someone talking about different kind of computing mechanism, including the new technologies that are going to improve our ability to create multiple algorithms can be managed in a fastest way. Quantum computing is going to play a huge role. And internet. Today, India is a great example of internet availability. In fact, my son-in-law who came in here last week from Germany, he was absolutely astonished that he was traveling from here to Tirupati and he was watching cricket match seamlessly, not even missing a beat anywhere. And this is possible only in India. He said in Germany it is not possible. And this is also going to change, and that's going to provide us a huge ammunition. And software and generative AI is going to be the future change. And generative AI, as all of you know, and last week has been a big news of Sam Altman and what's happening with the company, what's happening. But what is definitely known is the insights and the technologies that are coming through this new way of managing the data into knowledge is going to create an impact on healthcare. We are already in the process of looking at what can be done, how can it be creating a bigger impact on population. This is where, this chart talks about, you don't have to read through it, but it basically tells you about how much of data is being created on healthcare. Yesterday, Abhishek showed me a ring that he was wearing, a new technology developed by one of the startups here, which actually creates so much of data about his health. And these data that is created, the genomics and many more things, including the healthcare data that is coming and many other technologies can really help us actually get to a vertical data of human being. And in Siemens Healthineers, we are looking at three things that are going to change. One is preventive healthcare. Somebody talked about wellness management rather than disease management, and that's the future. To manage wellness, you need to really know what is likely to happen to you, and that's where we talk about digital twinning. Patient twinning is what we think is going to be the future, and we are looking at building patient twin or a human twin that will help us know what is likely to happen to humans using all the data that I showed previously. And this is not a solution that will happen tomorrow, but absolutely very near future. And quantum computing is going to help in a big way. That will lead us to precision health, where you can proactively manage your health and wellness. And that is going to eliminate so much of waste that is happening today in the industry. And this is an example of a digital twin, just for you to know, presently we have done digital twins on 2 organs, heart and liver. And today on a heart, on a digital twin, you can make some treatment planning and see what is likely to happen to that particular human being. And based on that, you can actually do it on an actual human being. So you will eliminate all the risks, and you will try all the risks on a twin, and you do it on a real patient. And these are going to revolutionize the sensing, all those gadgets we are talking about, robotics, which are going to help in bringing a lot of automation and artificial intelligence, the Gen AI, LLMs, these are going to really impact healthcare in a big way. While healthcare will be a little slower to adapt because of what we deal with is human health. We don't really take a jump just without thinking twice. And at the end, I will say, today we are all talking about automation, bringing in products and solutions that are making it possible to do it in an easy way. But the future is all about digital twins. Digital twin, which is going to lead to proactive management of health and bringing wellness to the focus. And that to us is going to be the sustainable healthcare in the future. With that, thank you.